Hello, today I'm just going to show you very simply how to draw up some Botox. I'm doing a small treatment this morning and I have a 50 unit vial of Botox that I'm going to reconstitute with bacteriostatic saline. I've already drawn up 1.25 mils of this into my syringe, which is the recommended dilution for 50 units. For 100 it's 2.5 mils, and for 200 units it's 5 mils. So to begin with, what I'm going to do is going to release the pressure in the vial of Botox. I do this by inserting a needle just in the bung, and you'll hear a fizzing sound. So now that pressure in the vial is now equal to the atmospheric pressure, I'm now going to inject my saline. The reason why we want to equalise the pressure is if the saline goes into the vial too quickly, it can become very frothy and your unit's injection may not be correct. You want it uniformly distributed within the fluid without any bubbles. So I'm just going to inject into the bung. Okay. And then I'm going to just very slowly, drop by drop, introduce the saline. Very, very slowly. And that's the vial empty. Withdraw. Withdraw this needle. And then very gently just mix it around. You can look for the little gap in the film of the Botox to see the fluid, and just make sure it's all swirled around. Once you have reconstituted your mixture with Botox, you need to draw it up. Now, we use very fine needles for Botox injections. I use 32 gauge needle, and obviously if I put that in the bung it would blunt it and it would increase discomfort for the patient. So we take the aluminium rim off very gently. It must be very gentle, and try just to catch the aluminium itself, not the glass, otherwise it will cause it to snap. And off comes the rim, and the bung has also come off also. So that leaves us with our reconstituted Botox. Now we draw up our required units from the vial. As you can see, this needle is very, very, very fine. So we push out any dead space. And the best way to try to do this is to have the vial on a tilt where you can see the there's a little strip where you can see through into the fluid. If you manage to gauge your needle through into the fluid without the needle touching the base of the glass, and start to pull up slowly, trying to avoid any air bubbles. And that's the fluid inside the syringe. If you do have any air bubbles, gently flick the side and expel. That's how to reconstitute and draw up